With the onset of fall, we are seeing an uptick in the number of COVID cases across the country, and that has Americans once again turning to at-home COVID tests.
Many of us stashed away the free government-issued test kits last year, but how do you know if they're still good to use? Well, some COVID-19 test kits have expiration dates that have long since passed. The good news is that the Food and Drug Administration recently determined that some of those tests may still be valid, and there are some easy ways to find out if yours is still safe and effective.
Joining us now in studio is CBS MoneyWatch reporter Megan Cerullo. Megan, this is such a good topic. We were talking about this off camera. A lot of people have these stashed in piles, maybe, or at least a pile at home, speaking of myself. How do you actually tell if your COVID test is expired? Because it's not just the date on the back that you should be paying attention to, right?
The first thing you'd think to do would be to look at the expiration date. But the fact is that the expiration dates that are printed on these packages, they're not always valid. And that's because the FDA has actually lengthened their shelf lives and extended the expiration dates on the back of these boxes. So tests that appear to be expired may not actually be expired. So don't run and throw them out because they could still be good to use. This test that I had at home, for example, the date that's printed on its back says, tells me that it expires, that it's supposed to expire next month in October. But I cross-checked it against the FDA's list. It maintains a list of authorized vaccines, including a column with their expiration dates. And this test is actually good through April of 2024.
Well, I already threw all mine out, so I missed the memo, clearly. But I'm just curious, why did the FDA extend the test past the dates that were already printed on the box?
The test manufacturers, like Abbott, for example, they periodically test their own test kits for accuracy. And when they were first manufactured, they hadn't been around for 22 months or 2 years. And so as a result of updated testing, they sent those results to the FDA. And if the tests do, in fact, deliver accurate results
that wasn't mine.
Beyond what's printed on the back of the box, they'll extend those dates.
So what happens, Megan, if you use a COVID test that is truly expired, way past its date?
Right. No one's advising that folks make use of truly expired COVID tests because those they can't be trusted. They're going to deliver inaccurate and invalid results. And there are telltale signs of a test being truly expired. Its parts will degrade. The solution in the dropper may be discolored or may have totally evaporated. So it's important not to use a test that's truly expired, and that's why the FDA makes it really easy for consumers to look at the lot number, look at the expiration date, and cross-check it against that list that they maintain. And manufacturers have indicated that the shelf lives could continue to expand if these tests continue to deliver accurate results.
And often what we find in food and other shelved items that the expiration date really is beyond the expiration date printed on the label. Megan Cerullo, thank you so much. Good information, news you can